My name is Kenneth Horstman, and I am a lead care coordinator with the Department of Office of Connected Care and Remote Patient Monitoring Home Telehealth. Remote Patient Monitoring Home Telehealth is a program where the veteran patient actually has a device in their home that they can monitor their vital signs. Other term you may hear is biometric data, which includes glucose numbers, also pulse ox, daily weights. We can also measure temperature, which became very important during the COVID pandemic, and other biometric data we can obtain to assess them on a daily basis. So a major part of our program is education with the patient. So for coaching and mentoring them, our primary goal was to foster independence. And the latest technology, which is exciting, is video technologies on the device that they get at home, so we can actually connect with them on that device and view their maybe their breathing status, or maybe they have some swelling, or maybe they have something concerning they want us to take a look at. So we can do video visits now, which is proven to be very helpful and life-saving in several cases.
I became involved after or upon visiting my primary care. We started to discuss the many health issues that I was having, and she brought up the subject of whether I might be interested in participating in the remote patient monitoring system. And I asked a couple of questions. She said, it involves some equipment at home, of which you're going to need to take some preliminary measurements. I said, well, that sounds interesting. So I said, sure, yes, definitely. And we've been doing this ever since. This home in telehealth is very, very important to me.
The VA is proud to say we've been doing this for a long time, and we have about 150,000 veterans a year that utilize our service, and that we have mastered it. We have veterans that didn't realize their health was degrading and prevented them from going in the hospital, and they were excited about that because they want to be at home. They don't want to be in an institution or a rehab or nursing home facility. So we're catching a lot of their medical problems early. So that prevents a hospitalization or an ER visit. It's just the overall improvement in our quality of life is just amazing. It's unbelievable the differences we're making doing this.
Well, I try not to bother Kenny. I know he has a very important job, but he's there all the time. I mean, God bless the man. He has not steered me wrong yet. He's been right there whenever I needed him for a problem I was having, and that's important to me.
We have witnessed home telehealth remote patient monitoring save lives on many different occasions. We have experienced nurses who are assessing and triaging these patients that are seasoned nurses who know how to recognize these issues and medical emergencies and to do appropriate triage. So home telehealth we have numerous examples of how it's saving lives. There were 132,000 patients enrolled in home telehealth in fiscal year 22, for example. And we get about 20,000 additional enrollments per year. We are proud of our numbers with our decrease in admission rates. Patients who enroll in home telehealth have approximately a 41% reduction in admission. We also found that approximately 70% reduction in bed days of care, and that's the number of days that they would actually be in the hospital. If they weren't in home telehealth, remote patient monitoring, they would have a much longer stay in the hospital because we're catching their illness and their problems earlier and we'll get them to the hospital so they don't have to stay as long. I'm just very happy that the VA has embraced this service and that the VA puts the funding into this service because it does make a difference. They have fought for our country and fought for us, and I feel like I'm fighting for them. I'm very compassionate about taking care of patients, but I'm also very compassionate about educating them so they can make the decisions in their own care to increase their quality of life.
Find more information on the VA Remote Patient Monitoring Home Telehealth Program at telehealth.va.gov/type/home, or discuss with your provider if the program is right for you.